So baby's figured out how to move its arms and legs. It's figured out how to roll over from front to back and from back to front. We figured out rocking, which in turn led to crawling. Normally, after crawling, and maybe as part of rocking, baby will figure out how to sit down. We're not really going to go over going from rocking or crawling to sitting. We're going to go from our 6-point position up to standing. And we can do that in two different ways. One, 6-point to half kneeling to standing. Two, 6-point to squat to stand. Both of these are ways that babies transition into standing. And once you're standing, you've got the world at your fingertips. And then you're just a liability to yourself and everybody around you for a few years while you figure out what your body is capable of and how to reason with your mind before simply just acting impulsively with your body. But that just takes practice. For some kids, it takes injury. For some kids, it takes mild electrocution. There are a lot of different ways in which a kid can get into trouble, but as adults, we're less likely to have that happen as we're exploring our developmental movement patterns. To recap, the developmental movement patterns are built into your early training program to help get dysfunctional movement closer to functional movement. We can do the soft tissue work, we can do the specific corrective exercises. You might be doing some specific physical therapy homework for a joint or joint segment that's not functioning the way it ought to. It's either a stable joint segment that's loosey-goosey, or a joint segment that's supposed to move, that's kind of locked down. If there's pain associated with those, when I do your functional movement screen, I'll send you to a physical therapist to get checked out, just to make sure that your training program doesn't take you places you're not supposed to go yet. You might need some specific therapy. A lot of times, that's a great way to start the communication back and forth between your trainer and other health professionals, either physical therapists, occupational therapists, or even surgeons. We want to have that communication. But once we do those corrective exercises, once we do that soft tissue work, we got to put it all together. And that's where the developmental movement patterns come in. And we can make a lot of progress by linking those three things up: soft tissue work, corrective exercises, and developmental movement patterns. We can prepare your body to start lifting, and that's what it's all about.